Kia ora tātou, no mai, hara mai, tēnā koutou, tēnā koutou, tēnā koutou katoa. Can I first of all acknowledge Richard for opening today's conference and for sharing his journey with us and with his family. Can I acknowledge President Mark? Yes, I do remember the debate. It was probably a lot of nonsense, but I remember those fun debates as a lot of fun. Can I also acknowledge Graham Woodside, who's done a lot of work in getting this organised for me to be here today. I particularly want to acknowledge John Nacey, Professor John Nacey, who over many years I've worked with, and he is a fine, upstanding man, clinician. Not only that, he's also my husband's clinician, so that's always helpful. But John is a Wellingtonian and as you know, has done a tremendous lot of work in prostate cancer. I also see Brett Delahunt, and he is another wonderful Wellingtonian, now your patron, and congratulations, Brett, it's fantastic. And you too have done some amazing work in health over many, many years. I also want to acknowledge our Australian visitors who are here. You are our closest cousins, and it's always good to have Australians working with us and us working with them. We learn so much from each other. So thank you very much for the invitation to be here, to show support for the Foundation and solidarity with patients and carers, your family and whānau, and also the health professionals and carers who work in this space. Living with Prostate Cancer Journey, that is the name of your conference. And what I thought I'd talk today a little about is, in fact, around the process that we do have in Parliament for looking at such issues. I don't know whether Barbara is here. If Barbara Stewart, is she here? Barbara is a New Zealand First Member of Parliament on the Health Select Committee, and I know she is arriving sometime today. But we have a very non-partisan health committee in Parliament, and that's been the case for a long time. It's a very good committee. Some health select committees are very partisan. They are fractious and highly political. But that has not been the case at the Health Select Committee for a long time, and I think that has helped us a lot in terms of making decisions at the Select Committee. So why do we have Select Committees? Some of you will know that or you'll all know, I should think, that we are a single chamber house of Parliament. Unlike our Australian cousins, they have an upper house and a lower house. We have one house. We disestablished our upper house in the early 1950s. And so select committees were set up to take on the audit and oversight role of which an upper chamber normally would. So our select committees are powerful select committees. They do have the right to subpoena, they have the right to investigate and to inquire into anything and everything they like. So they perform a very important role. And the Health Select Committee over the last few years has produced some very important work. In the end of 2013, we produced a report, an inquiry into children's health in New Zealand. And we looked at children's health before birth right up to the age of 5, looking at the evidence, what we ought to do to improve the health of all our children. Some years before that, we did an inquiry into mental health and the impact of cannabis on mental health in New Zealand. We are now looking at a petition on surgical mesh, and some of you may have heard of the issues around surgical mesh. And of course, the latest one that we've received is the end of life petition. And the end of life petition, we decided at the Select Committee last week that under the umbrella of the petition, we will undertake an inquiry. And that petition is asking to look at appropriate legislation or not for end-of-life choices. And I think there'll be a lot of interest in that by the public and the Select Committee. As many of you will be aware, the prostate cancer was subject to a Select Committee inquiry in 2011. And it was an update, and that's 4 years ago, so 4 years on, I was really interested in Mark's wish list and the things that he set out that are happening. But the inquiry at that stage looked at the latest data on prostate cancer, and I'm not going to rehearse all of the figures, you know them, you don't need to hear them all again, but it did update on the 2004 National Health Committee work. And the 2011 Select Committee found that the recommendation that came out of the National Health Committee in 2004, which didn't recommend screening men without symptoms for prostate cancer, regardless of age, because of the risks associated with screening and subsequent treatment exceeding benefits. They said that had led to confusion amongst men as to what sort of action they should take, and they found that GPs in particular were giving different advice. So while the government reaffirmed the position of the National Health Committee in relation to screening, the Select Committee did make 17 recommendations to the government at that stage. They heard a lot of evidence and looked at a lot of data. And I thought I'd just share some of them. Actually, they link into some of the things you said, Mark. But the first one was to encourage and promote the case for men to seek up-to-date, evidence-based information from their GP about the advantages and disadvantages of screening and the treatment of prostate cancer. The second one was to encourage and promote the case for GPs to provide men with initial consultations about advantages and disadvantages about screening and treatment that should take place, we recommended, during a cardiovascular risk assessment. The third one was to encourage GPs to advise men with strong history, a strong background history of their family of prostate cancer, to have choice to undergo clinical examination and PSA screening and rectal examination from the age of 40. The fourth one is to establish a quality improvement program relating to early detection and treatment. The program should ensure that all men with prostate cancer have fair access to good quality health care. And that recommendation was said that we wanted it to be achieved within 12 months. That was 2011, so I take some of the points that you're making, Mark. And the fifth one I wanted to mention was that the government fund the Ministry of Health to work with NGO groups of patients and health professionals to set priorities and develop processes to implement a national quality improvement plan. The government, in response to that inquiry, when a select committee undertakes an inquiry, the government is required to respond to it within 3 months. And they responded by supporting most of the recommendations. What we don't know, of course, at the select committee is what progress have we made on those recommendations. And I think it's really important that we, in fact, after a period of time, perhaps 5 years, which would be this year coming up, that we bring back people who've been involved, people like John and others, and the foundation, and ask what has happened, that we actually check what we recommend against action. And I think that is something that I will recommend to the Select Committee this week when we meet again. Because often inquiries can sit on the shelf and gather dust or not be taken seriously, and we don't see the progress that ought to be made. And I think that that's very important, closing the circle, if you like, of an inquiry at a Select Committee of Parliament, and then after a period seeing, did we make any progress? Were we successful in anything we did? Can I just, because the bell's gone, is that giving me 1 minute, is it? 1 minute? Can I just, there was a couple of things that Mark said that I just quickly want to comment on. We do have a fragile workforce in cancer, which requires a lot of work. We also have a fragile, if you like, funding in drugs for New Zealanders, and one of the areas where I think that we are going to need to increase our emphasis is in the funding that goes to Pharmac. Pharmac received $800 million out of $15.9 billion at this last budget, and it's been almost the same now for about the last 4 or 5 years. And so to get access to modern, up-to-date drugs for treatment, particularly the cancer drugs, which are expensive drugs, is going to require a greater commitment to the overall health budget, knowing it's tight, but an overall health budget, a greater commitment in that area of pharmaceuticals. And finally, I'd just like to say that as a woman, I always find that men find it much harder to talk about their health than women. And I said to John, I think it comes from the fact that from a very early age we're told we must go and have cervical screening, we must go and have breast screening, and if you've had a baby you've got no pride left anyway, so you often don't mind turning up for examination. We really do need to do a lot more for men's health, because our men are those who, in terms of inequity, particularly for our Māori and Pacifica men, but men in general, we do not have a great enough emphasis on your health. And after all, you are rather special to us and we do need you. So that I think is an area where we could do further work, and I hope that we do. But thank you for this opportunity to be here this morning.